Hello everyone. Today, we're going to be discussing a question from Typical PT's platform. Let's jump right in. All right, here's the question. A 51-year-old male presents to physical therapy following referral from his PCP for evaluation of recurring episodes of severe dizziness for the past 3 years. He describes the sensation as the room spinning violently, with episodes lasting 2 to 4 hours. These attacks occur unpredictably, approximately once every 1 to 2 months. He reports fluctuating hearing in his right ear, occasional right-sided tinnitus described as a roaring sound, and periodic feelings of fullness or pressure in the affected ear. Symptoms have progressively worsened, causing him to miss work and avoid driving. His PCP prescribed meclizine, which has provided minimal to moderate relief during episodes. Objective findings. Cranial nerve screen shows intact facial movement and sensation. Balance testing shows a positive Fukuda stepping test with rotation toward the right side, negative Dix-Hallpike maneuver, and increased sway in all conditions of the modified CT-SIB. Gait is normal between episodes, but the patient reports needing to sit or lie down during acute attacks. Vestibular screening shows a negative head thrust test and no positional triggers identified during examination. Occupation. Accountant reports increased stress during tax season. Living situation. 2-story home with spouse, no children. During your objective test, you perform the MCT-SIB as shown in the image below. Based on the image, what systems are being assessed? A. Somatosensory and vestibular. B. Vision and vestibular. C. Vestibular. D. All systems, somatosensory, vision, vestibular. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is B. Vision and vestibular. Answer choice B is correct. The image shows the patient standing on a dynamic surface with the eyes open. When the surface is unstable, the somatosensory or proprioceptive input becomes unreliable. Because of this, the patient must depend primarily on the visual system and the vestibular system to maintain balance. Looking at the diagram, the MCT-SIB table shows the 4 conditions. Condition 1, eyes open on a firm surface, allows all 3 systems to be used. Condition 2, eyes closed on a firm surface, removes vision so the patient relies on somatosensory and vestibular input. Condition 3, eyes open on a foam surface, makes somatosensory input unreliable, so balance depends on vision and vestibular input. Condition 4, eyes closed on a foam surface, removes vision and distorts somatosensory input, which isolates the vestibular system. The image in the question corresponds to the 3rd condition, eyes open on a foam surface, which tests vision and vestibular function. Now let's go through why the other choices are incorrect. Choice A, somatosensory and vestibular, would correspond to eyes closed on a firm surface, where vision is removed but somatosensory input is still reliable. That is not the condition shown. Choice C, vestibular only, would correspond to eyes closed on a foam surface, where vision is removed and somatosensory input is distorted. That is not what the image shows. Choice D, all systems, would correspond to eyes open on a firm surface, where somatosensory, visual, and vestibular input are all available. That condition is also not shown in the image. Now that you've completed this case, take a moment to record the key points in your Typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing neuromuscular-related conditions. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.